Gill. My name is DeEdra, and I'm going to be your social worker for the next few months. Can we start off by telling me what your understanding is of why you're here?
I really don't know why I'm here. I mean, I was told that my children weren't safe because I pop pills every now and again.
Okay, well, according to the referral, there were some concerns about your drug use, your epilepsy, and passing out from time to time. Can you tell me what's going on with you?
I mean, as you said, I do have epilepsy. I mean, I don't see that being a reason to take my kids away.
Okay, and tell me more about the allegations of drug use.
Like I said before, I do pop pills every now and again, but I don't see anything wrong with that.
Okay, Ms. Gill, what I would like to do is start from the beginning and get your perspective on things, and from there we can work towards getting your children back and seeing what will work best for you.
Well, yeah, honestly, that's my only concern. So whatever I need to do to get them back, I'll do it.
Great. I'm glad to hear that you're willing to cooperate and eager to get your children back. In your file, it states that you were diagnosed with bipolar disorder. Can you tell me more about that?
Yeah, I was diagnosed about 8 years ago, and that's when things kind of started going downhill a little bit.
Okay, and are you taking any medications for that?
Not right now. I was, but I didn't like the way it made me feel, and the pills that I got on my own seemed to make me feel better. So
When you say pills you got on your own, what pills are you speaking of?
mostly handlebars or like whatever else I could get my hands on.
Okay, and what were some of the other pills that you were taking?
Someone's and Darvocet.
Okay, thank you for sharing that with me. Have you had any other issues with substance use?
I mean, I drink too, but that's all.
Okay, and when you're taking these pills and drinking alcohol, where are your children?
They're at home with me and my mom.
And is your mother able to assist with caring for the children should you have a passing out episode?
No, she's disabled, and I take care of her.
Okay. Do you have any concerns about your children being left unattended when you're having a seizure or intoxicated?
I mean, I can see why it would be a concern to you, but Kiana's pretty responsible, and like she can handle everything until like I wake up.
And what exactly is Kiana responsible for during those times?
She's just supposed to make sure like her brothers and sisters are fed, make sure that Darius' diaper is clean and stuff like that.
Okay, I'm worried that you're putting too many parental responsibilities on an 8-year-old that can potentially lead to something dangerous occurring. Have you ever considered taking parenting classes to learn about what age-appropriate responsibilities are for children?
No, is that something you recommend?
Yes, I think it's something that you should strongly consider, and we can go into that a little further later once we start discussing your recommendations.
Okay, that's fine. Like I said, whatever I have to do, I'll do it.
That's great, and I appreciate your cooperation. Now I'd like to go into a little more detail on why you're taking pills. Earlier you said you're not taking your medication for your bipolar disorder, but that these other pills make you feel better. What bipolar medications were you taking?
I was prescribed Seroquel, but I hated it, so I stopped taking it.
Okay, excuse me, and did you ever speak with your psychiatrist about how the Seroquel was making you feel?
A couple of months ago, his office closed down, so I never got a chance to speak with him about it.
Okay, and how about now? Are you still receiving Medicaid benefits?
Yes, I am.
Okay, good. I would suggest that you contact Medicaid to seek out another psychiatrist so that they can assist you with getting your medications on track that is both effective and comfortable for you.
Okay, I don't have a problem with that. I mean, but I really kind of feel like what I've been doing is working, so if it's broke, if it's not broken, don't try to fix it.
Well, from what I've gathered thus far, it seems as though you are self-medicating to help with your condition, and it seems that it's having some adverse effects on your health. Additionally, I'm wondering if these medications mixed with alcohol is contributing to your seizures, which is another reason why I would like for you to speak with a psychiatrist.
Oh, well, I guess you do have a point.
Before you leave today, I would like for you to stop by the receptionist desk and get the number directly to Medicaid Psychiatric Services. If you need some assistance in speaking with them so that they can get you to the right person, I don't mind helping you with that.
Okay, thank you. I appreciate that.
Absolutely. So from here, why don't we go ahead and conclude today's meeting, and the next time we meet, we should have an update on you getting a hold of a new psychiatrist. How does that sound?
It sounds pretty good. I mean, are we meeting? When's our next meeting? When's our next meeting?
Well, why don't you tell me some day that's good for you?
Tuesday's work.
Okay, so let's do that. Let's set it for next Tuesday at 2 o'clock p.m. Is that okay?
Yeah, I think that's fine. It'll work for me.
Okay, great. It was nice speaking with you. You have a good day.
I'm glad to see you again. I've been looking forward to following up with you since our last meeting to discuss your hospital evaluation.
Yeah, I'm glad we got out of the hospital and done with that evaluation.
Well, getting your health back on track is a priority, and it was a necessary step for you to be able to get your kids back. So, tell me about your treatment plan from the doctors.
Where do I start? The doctors prescribed me new medication for my bipolar disorder. I stayed there for 5 days before they cleared me to leave. Every day, several times a day, I had to meet with the counselor to see how I was feeling and if the medication was working. I would check in with them in the morning, after breakfast, after lunch, and then finally after dinner.
I see. So, how did those check-ins make you feel?
The first 2 days I felt agitated and annoyed, and then on day 3 I felt more comfortable with meeting all of those times. It became routine, you know. I know some of it was because I hadn't had a drink and getting used to the new meds.
Are you comfortable with continuing a routine to meet with someone?
Yeah, I feel like I almost need it now.
It's important that we implement this into your intervention plan to reach your goals to get your kids back. How often do you think you should meet with them?
Well, I could meet every day since I don't have the kids right now, but making sure someone is there to care for Mama is the issue. I know she was in that place for a while, and while I was in the hospital, but I'm not sure how that works.
I understand. So that's another concern that needs to be addressed. I believe you can check with the APS caseworker. They may have some adult daycare resources.
That's great and all, but if I have to take her there, it's going to be another problem since I don't have transportation. I had to beg my neighbor to bring me here today, plus Mama needs a wheelchair lift.
Well, some of them have transportation services included, but while you were in the hospital, I found some temporarily free and discounted bus programs that could work for you and your mom. The buses already have a wheelchair lift in them.
Oh, okay. Well, thank you.
I want to get back to your routine meetings. So, who do you want to meet with?
They said I could continue to meet with the counselor at the hospital as outpatient, but we didn't talk a lot about me craving a drink.
Let me ask you. So, have you ever been to an Alcoholics Anonymous group before?
No.
Okay. They have local groups in the area where you can go daily and discuss drinking with people who have similar issues. It requires you to obtain a sponsor, as well as allows you to see the counselor at the hospital to discuss the bipolar disorder. The counselor and the psychiatrist at the hospital can monitor how you're feeling on your prescription meds and with those kind of cravings.
Man, that's a lot of people to see and talk to.
Well, when you think about it, you check in 3 times a day at the hospital. These people, the counselors, psychiatrists, sponsors, APS, caseworker, including me, would allow you to check in at least twice a day with someone.
You forgot the bus bar. Yeah, you're right. I will stay on the phone with someone. We have talked a lot about me and my needs, but what about my kids? You want me to make sure they have support, right?
Well, this is a very important part of taking care of their needs. Let's talk about some of the other risks and concerns we haven't addressed. Do you have additional support systems in place?
Support like child support or like my aunt?
Well, both. One is dealing with financial support and the other is physical help.
Well, I have Social Security, food stamps, and housing, but no child support, and my aunt is the only one that can help me.
Well, your sobriety and health is an important part of you making sure you stay eligible for these assistance programs and keeping up with those appointments. We can offer you some resources from organizations that can give you additional support for your kids through mentoring and possibly childcare since you qualify for many of the other assistance programs.
This is the most important thing to me. Getting them back and keeping them is what's important. This is too many times this is happening.
Yeah, this is the goal. Because this is a repeated offense, we want to make sure that we provide you with as many resources and supports as necessary to keep the children safe. We've talked about a lot today, so maybe we can work on some of that a little bit later. How does that sound?
That sounds good. Will we meet again next week?
Yeah, we actually can meet again next week, but I want to make sure that we're able to give you some of those resources that we talked about earlier, and I want to make sure you're clear on what you need to do.
Okay, well, I appreciate you helping me with all of this.
Sounds good. I think if you give me just a minute to gather those things, then we can go over that and kind of wrap up the session for today since we talked about quite a few things.
Okay, sounds good. I'm available next Tuesday if you want to set it for then.
Okay, I'll let her know out front that we can do that.
Okay, thank you.
Thank you.
Thank you, Gail, for waiting. So now during this time, if you don't mind, we can actually do an overview of everything we talked about and go over the recommendations that I've taken the time to type up for you.
Okay.
Alright, so far we have discussed your health conditions and improving those, your addictions to alcohol and drugs, recreational drugs, and establishing care for your mother while you are in treatment.
Okay.
Alright, so at this time, as I said, I've typed up the recommendations for us to go over. You will receive this copy at the end, but I just want to go over everything with you.
Okay.
Alright, so basically, for the first recommendation, in order for you to regain custody of your children, you are required to both refer yourself and your mother to services.
Okay.
Okay, so you will continue basically to attend your appointments with your primary physician.
Okay.
Okay, so we talked earlier about your addictions to alcohol and drugs and how this has a negative effect on your health. So when you mix those, so I'm referring that you meet with a physician to discuss the rehabilitation that you are in need of because of the alcohol abuse and drug abuse.
Okay.
Okay? So, when I mentioned earlier about your mother and yourself getting the treatment y'all needed, I was referring to outpatient treatment. So, during this outpatient treatment, this will be an opportunity for you to basically find ways to cope with the stress you are experiencing. So it'll give you good insight on techniques. They use a lot of mindfulness techniques during these sessions. So gaining mindfulness and managing that stress and learning how to cope with it so you don't always feel so overwhelmed and feel like you have to resort to using drugs or alcohol.
Okay.
All right. And along with that outpatient treatment, I also thought it was best for you to go over those parenting classes we talked about earlier.
Mm-hmm.
So engaging in that, and that can just basically give you a better understanding of what is appropriate for your children to be doing at their age. So,
Okay.
give you a better understanding of that. So it's a more in-depth description of that in those sessions for you.
Okay.
Okay? So, I know we spoke about you wanting to make sure your mother is being taken care of while you are attending treatment and services. So, I suggest that you follow up with the APS worker. Her name is Susie, and I have provided her contact information for you right here.
Okay.
Okay? So basically, with her, y'all will basically address the adult daycare services that APS provides.
Okay.
Okay? So, with that being said, this will give you the opportunity to attend the Narcotics Anonymous and Alcohol Anonymous support groups. And this is required of you.
Okay.
Okay? So you will need to find a sponsor to attend these sessions with, and they do offer them daily. As you said earlier, you're still willing. This is something you're willing to do on a daily basis.
Yeah.
Okay, that sounds good. So, you will meet with them weekly, and you need to always remember it is important to follow up with your sponsor.
Okay.
Okay, that's important. I know you may feel like you have a lot of people to follow up with, but that is very crucial to your success in this journey.
Yes, ma'am.
All right. Okay, so that basically wraps up the recommendation portion of our session. I have also included a list of the names and contact information for the resources we spoke about. And if you have any questions about this, we can further discuss it in our next session.
Okay. Do you know if any of these places are close to my home?
Yes, all these places are close to your home, and they're on that bus route we talked about earlier. The
Okay.
discounted bus route.
Sounds good, thank you.
All right, you have a good one.